So hello everyone, once again welcome to my channel. In today's video we talk about IV fluids. IV fluids are the most common term or the words which we are using in our day-to-day life in the hospital industry. So IV fluids is nothing but administration of fluid inside your veins. That means it is the most commonly seen therapy in the hospital for almost like every of the patient. IV fluid therapy is the administration of intravenous fluid in the vein. We have multiple IV fluids, you can say. So for different patients, for different uses, we need a different form of IV fluid. So we'll quickly see what are the different forms of IV fluids, how to categorize IV fluid, which IV fluid is suitable for which candidate. So in this video we will covering all these topics. So on a broader aspect, IV fluids are classified into two categories, that is crystalloids and colloids. As the name is telling, crystalloids means very small particles or very small molecules. These are very easy to use and it will provide immediate fluid resuscitation. That means when you need immediate effect, so that time we use crystalloids. So the most common example of crystalloids are normal saline, DNS, RL, dextrose, isolate P. That is whatever you are listening on a very day-to-day basis, all are the example of crystalloids. Then comes your colloids. Colloids, as the name is telling, the molecule size is bigger or larger. And whenever you are using colloids, use it very cautiously, and because it will promote more allergic reactions. And the example of colloids are albumin, dextran, and HES. So these are the example of colloids. Now talk about the full form and the short forms. So normally we are using the words NS, DNS, D5, mannitol, RL. What does it mean? NS means normal saline. DNS means dextrose normal saline. D5, D10, D25, D stands here for dextrose, and these 5, 10, 25, this is the percentage. So this is a number which represents percentage. Then we have RL. RL stands for ringer lactate. So it is very important to know the full form of this short words, because sometimes we don't even realize what is the full form of this DNS, what is the full form of NS. It is important to know. Now come upon the normal saline or NS. So it is available in various concentration. So one of the most commonly used concentration is 0.9% NaCl. So NaCl is your sodium and chloride. Mainly because of the presence of sodium, its taste is a little bit salty, and it is safe to administer to all the patients, but except in the case of hypertension, as it contains sodium, so it is not recommended for a hypertensive client. Uses for NaCl is like dehydration. We can give it in the form in all the patients of dehydration with except hypertension. It can also be used for wound dressing at the time of surgical, you can say, when we are doing any sort of dressing. So for wound washing it can be used. For dilution of drugs, we got diluted along with the drugs, but if you need, you can just dilute it with normal saline also if it is not prohibited. Then comes your DNS, that stands for dextrose normal saline. Here we have dextrose also, which is combined with normal saline. Dextrose is nothing but it's a form of sugar. So here we have 0.9% of NaCl plus 5 gram of dextrose in a 500 ml of DNS. So that makes your DNS. Now quickly see what are the uses. Again, it can be used for dehydration. Suppose if the patient is having vomiting, if the patient is having diarrhea, if the patient is having bleeding, you can use this DNS. It can also be used for hypertension as it contains normal saline, so it will increase the blood pressure. Also used for the treatment of insulin shock because it contains dextrose also, but it is not recommended for DM patients. So that is a star mark. Then comes your RL, that is your ringer lactate. So RL stands for ringer lactate. Ringer lactate is a very good fluid which is like we can use it in multiple conditions because it contains mixture of many electrolytes like sodium chloride, potassium chloride, sodium lactate. So this can be used for multiple conditions. This is a very good fluid. So the use of this fluid is, again, for no doubt, number one is dehydration. You can always give it in the patients of dehydration. If somebody is having electrolyte imbalance because of vomiting, because of multiple episodes of vomiting, you can give it in that cases. Surgery, if the patient is NPO, and post surgery also we are not starting diet very soon. So in case of surgery also, burns, nutritional deficiency, hypertension, this is also suitable for diabetic patient, DM, that is diabetic mellitus. So you can also give this fluid in the patient in diabetic patient. Then comes your dextrose. Dextrose is nothing but it's a form of sugar. So I have written like D5, D10, D25. That means 5 gram of dextrose in 100 ml of solution. That is again 10 gram in 100 ml, 25 gram. Uses, it can be used in dehydration, of course, weakness and dizziness. And sometimes the patient is having hypoglycemia. You can give just dextrose. You can also go with dextrose solution. Then comes your mannitol. Mannitol is nothing but it's a form of diuretic, and mannitol is given if the patient is having increased intracranial pressure. So to decrease that intracranial pressure, we are administering mannitol. So how mannitol work? It will just remove all the excessive fluid from the body, and it will increases the urine output. So we can give mannitol also as a form of IV fluid. Next IV fluid is isolite P. Isolite P is also very good IV fluid which contains lots of electrolyte, and it is same as of your RL, but the main difference, it is used in pediatric, and the RL is used in adults. Isolite P, it contains sodium, potassium, magnesium, chloride, and acetate, so it can be used for multiple conditions. Then we have categorization of fluid in isotonic, hypertonic and hypotonic. Isotonic means when the fluid concentration is same as of blood. So that is your normal saline 0.9% and RL you can give as a isotonic solution. If we talk about hypertonic, that means the concentration of fluid is more than that of blood. So that means 3% of normal saline, 5% dextrose, D10, these all are hypertonic solution. And if you talk about hypotonic solution, that means if when the concentration of fluid is less than the blood. So that is 0.45% of normal saline. So these are hypotonic solution. So this is all about for this fluid. If you have in this video, if you have any doubt, any queries, you can just put in the comment box, and I'll try to clarify all the doubts and queries. So that's all for this video. Just stay tuned for the next video. Thank you so much.